Hi everybody, Dr. Rob DiMartino here with Superior Health Solutions. Today we wanted to make this video for you about peripheral neuropathy. It's interesting because peripheral neuropathy is one of those diseases that kind of gets pushed to the side. Reason being is because it usually comes with another disease process. Most common reason for peripheral neuropathy obviously is diabetes, or people with fibromyalgia will get it. But there's 24 million people in the US suffering from this, but again, it doesn't get talked about a lot for a couple of reasons. One, it goes with another disease. Two, just not a lot of really good treatment options to deal with it. Hopefully the purpose of this video is to give you the idea of why this actually will occur. And all the different things. This is not as simple as it sounds. There's a lot of different reasons why somebody will get a neuropathy. And the key to this is you have to search out the reasons in the front end so that you can identify the actual cause, so that if you can handle that, you're not even really treating the neuropathy directly, people will start to get better. So one of the most important things right off the bat is we're going to add some branches here. We want to know what kind of neuropathy it is from a neurological perspective. Is it affecting a motor nerve? Meaning, does it affect the way the nerves control the muscles? A good idea with this to know is if you're getting restlessness, movement of the legs, like restless legs when you're trying to rest, that's a pretty good idea you're affecting a motor nerve. Is it affecting the sensory component of what you feel? Do you get the creepy crawlies? Do you get the sensations? Do you get the burning? That's a really good idea something like this is going on. Is it an autonomic problem? Autonomic is basically actually not a peripheral neuropathy, but a central neuropathy. The interesting way that you can tell out about this one is if you're getting symptoms that are on both sides, both arms, both hands, both legs, both feet, something along those lines, there's a really good chance that it's an autonomic neuropathy and not a true peripheral neuropathy. And it's an important thing because you treat them completely differently. So you have to be aware of that. One of the other major things that we look for is if there's toxicity-based issues. Tons of research out there talking about lead toxins and heavy metals and different exposures like that that will create nerve problems. You know, and remember, the last generation was the lead generation. Lead pipes, lead paint, all that stuff. I know it seems odd to think about it in the environment and how somehow it gets into your body, but I promise you that it does. It's a huge reason why people get tripped up. Well, we talk about this being really common. Probably 35% of all these neuropathies go with diabetes. But it doesn't just have to relate to blood sugar. It can relate to what your insulin control is. And this is something that typically doesn't get tested on most blood work. So we look at your blood sugar levels on blood work and it looks normal. It's a snapshot of where your blood sugar is at that moment. But the reality of it is if your insulin levels are really high, meaning that your pancreas is working 4 times as hard as it should be to keep your blood sugar levels normal, that's going to antagonize the nerves. Insulin's very toxic towards nerves, and that's going to screw up the function. And it's something that will get missed. People say, well, I'm not diabetic, but their insulin is out of balance, and they end up having a diabetic neuropathy almost without actually having diabetes. A really common place where this gets missed and will still propagate the problem. Another big one here is statin medication. So medication for high cholesterol. Nerves are surrounded by cholesterol, and there's no idea in a statin that's a chip that says this is good, this is bad, go after it. Statins, as a side effect, will affect nerve function. Okay, 20% of your brain's weight is made up of cholesterol. About 15% of all the statins that we see, the neuropathies that we see in this office are caused by statin medication. It's a really common one that will get underlooked at a lot of the times, and sometimes that can have to go with toxicity. A major one here too is autoimmune reactions. So basically, your immune system mistakenly attacking itself, thinking that there's something going wrong and that's foreign tissue and it's going to go after it. Specific blood labs that you can do to see if that. A real good hint. If you get sick, does it spiral your problems? Are you taking a lengthy list of supplements and nothing seems to do anything? That's a really good idea that there's autoimmunity going on as well. Another major place for this that doesn't get looked at too often is thyroid. Thyroid is usually talked about because it'll have a lot to do with metabolism, weight loss, things like that. But the #1 search problem on Google is chronic fatigue. #1 reason for that is thyroid. Thyroid is probably the most underdiagnosed or misdiagnosed problem that we see. But as a side effect that nobody really talks about a lot of times, if your thyroid's not functioning well, a lot of the times it will give you the symptoms of neuropathy. So it's an important marker. And again, you probably had blood work, and they probably checked your TSH levels, maybe even got a T4 in there to see what's going on, but that's not the whole story if your thyroid is creating neuropathy. There's 5 other markers you need to look at. 2 of them are autoimmune markers, but they're massively important to figure out what's going on. Lastly, you always want to see how the gut's functioning. And the big one here is if somebody has gluten sensitivity. They don't have to have full-blown celiac, don't have to have full-blown food allergies to gluten, but they can be sensitive to gluten, and that will create symptoms of neuropathy. We always thought that gluten had everything just to do with the stomach. Now we're finding that it creates a lot of what they call neurogenic inflammation, nerve-based inflammation. Inflammatory markers, obviously important to read here, they're going to create a part, in all of this, inflammation is going to be involved. Gluten may be the thing that's driving that reaction. So hopefully by this web here, you can kind of see that there's a lot of different reasons as to why neuropathy can go down. And truth be told, it's not always just one of these. You may have a combination. You may have autoimmune of the thyroid. There may be a statin medication. It may be a toxicity issue, which is what's throwing your insulin levels off. That's the key to this. The heavy lifting comes into the front. But if you can identify the key players and you know 100% of what's going wrong, the path to proceed of getting some relief from this problem actually becomes really possible. I hope this helps. There's a ton of information. Click down below. A patient advocate will be waiting to talk to you, walk you through this. We'll look at your labs, fill in what you need. This is the key to starting to get help with peripheral neuropathy.